Hello and welcome friends. I'm Dr. Pallavi Chaturvedi from Mumbai and I am coming to you with a strong message of enrolling for the HHF Academy course, the private batch 2, which is going to begin very soon. And if you are interested in raising your level, your scale in homeopathic practice as a homeopath and build your career, and you're strongly motivated to practice homeopathy and give the results that you have seen your masters delivering, or the messages that they have given us in our books, and you want to lay a foundation on homeopathy and you want to rise multifold, then this is the opportunity. Our private batch 2 course is beginning very soon with HHF Academy, and already the seats are fast filling, and you want to make your name in this field, then just enroll for it. And the details are given in our HHF Field Telegram group, in our Facebook page. HHF Field named Facebook page is there, so you can join our groups over there and look into the details. What does this masterclass hold for you? And so saying, I would continue the journey of phosphoric acid from dancing unconscious. And there is a rubric given in puberty in phosphoric acid. You see, at the time of puberty, how a person is. There is a sense of immaturity, there is a sense of uh, there is a increased sense of sensitiveness for little things, and the fancies, and the exaltation when you see people who are doing very good in their life, and you feeling wow, and I will also do it. And there is a different sort of energy at the time of puberty. You have a lot of curiosity, a lot of excitement, and that's the kind of excitement, the fancies that phosphoric acid beholds. And then comes a complete downfall, where and you see in the keynotes how it is mentioned, mental as well as physical prostration. Now, why does this kind of downfall happen? From unconscious dancing, from the fancies, how phosphoric acid lands into this state of prostration, a complete prostration of mind and body. Why does this happen? If we see the ailments from a phosphoric acid, it says ailments from anger with silent grief. What brings in this anger? What happens? Anger suppressed, fright menses during, rudeness of others, ailments from anxiety, ailments from moral excitement, ailments from sad emotions, ailments from grief prolonged, ailments from homesickness, ailments from jealousy, ailments from death of loved ones, ailments from mental shock, ailments from sexual excesses, ailments from embarrassment, and ailments from friendship deceived. Now, in phosphoric acid, I will give you one example. There's a lady who would bring her daughter for her treatment, and she was the elder daughter. She has one more younger daughter, and she has a younger son also, but she was the eldest daughter, and being the first daughter, she had given all the love and attention to this elder daughter right from day one. And you know how the first child is the most precious child for a mother, and the first feeling of motherhood that the first child gives. So since the childhood, she looked up to her for everything, and she had high expectations from her. And although other two children were also very much lovable for her, but being the first one, the excitement, when I became mother for the first time, how much I have written about my first child, I have not written so much about my second child. How many pictures I have clicked for the first one, I have not clicked those many pictures for my second one, because then you are so much busy with a lot of other things at hand already. And you feel, this is very common, this happens in children, this is very common. But with the first child, it's like, your curiosity and your excitement, that oh, she smiled for the first time, oh, she spoke for the first time. But with the second, that this is going to happen. And I was a little casual, but maybe this is not with every parent, but for this mother also, it was something like, my daughter, and she had the daughter had hypothyroidism, for which she sought her treatment, and it got even cured within few months, like 2-3 months, and the reports were normal. It was just the beginning of hypothyroidism. She had not started any tablets. And so I had taken the case of the elder daughter. She was um, very difficult to deal with. Actually, she would not talk to me very smoothly, and I had difficulty in communicating with her, in understanding her. And she was not interested in studies, and she is from a Muslim family, okay. And the daughter did not want to study. She sent her to a place where they learn more about their uh, what they say, mythology and everything. So she was like, if you don't want to go to school, at least you know about your religion more. So like that, she was giving her all the liberty what she wants to do in life. But then gradually I came to know that, this girl has pelvic infections, fungal infections. And she used to be fine. Her thyroid report became normal with pulsatilla. And then after the report was normal, she started complaining about pelvic fungal infections. So then I got little worried that, why this girl is having pelvic infection, so something related to sexual sphere. And I directly questioned her that, how's your boyfriend doing. And then she opened up. She was alone that day, and then she revealed to me that, yes, I have a boyfriend, and this and that, her story, that he's the son of my the tailor who stays in our area, and he's his son. And I keep going there, with the excuse that I want to get this stitched, can get that stitched, and I keep meeting him. So I was taken aback. I was like, do your family know about it, about your relation? Since how long you're in this relation? And she was like, no one knows about it, and I am in relation with him for quite a long time. And I was like, okay. But then she was like, doctor, please don't tell this to my mom, and don't disclose it to anybody. So I was like, okay. And this is a little tricky scenario for a doctor to deal with, when a patient says that, don't tell this to my another family member. So I was keeping it very much under close covers. And then what happened one day, her mom called me up, and she's like, doctor, my daughter is missing. Did she call you up, or did she come to your clinic in the last few days? And I was like, last she came to me 15 days back, and she was quite okay. And then she was so much in tears, and she's like, doctor, she's been missing for last 2 days, and we are tracking her everywhere, but she's not reachable, and her phone is not reachable, and we don't know where she's gone. And I was like taken aback. I was full of guilt. I should have not kept it under covers, and I should have told this to her. And then next day I called her up, asking that, did you figure out what happened? So she's like, doctor, she ran away with a boy who was a neighbor, next door neighbor, and they were not even well to do. He was just a tailor's son. And she has spoiled the name of our family in the society. I can't even go out of the house now. And she got married with him, and she's staying in some dirty place in a very bad low-lying slum area. And I was like, shit, this is not something done. And this is what happens in phosphoric acid, sudden trauma, sudden setback, sudden shock. This is a moral excitement, moral, something like a right and wrong. I did so much for my daughter, and my daughter is doing this to me. This is not done, this is not justified. You had promised me that, you will marry me, and I kept waiting for you for so many long years. And I was so excited. I was always on cloud nine that, yes, once he comes back from US and we are going to get married, or anything that morally seems right, and the person is super excited about it, building castles, and having a lot of plans, and just thinking about in the air, and yeah, I'm in a relation or something like that. and then suddenly they come to know that he is ditched, or he's gone away, or he has cut off from her or him, and all the fancies, everything comes down. And that coming down is the downfall of phosphoric acid. So the child, in a child, how will you recognize phosphoric acid? A child who was very much lively and playful, and suddenly after the loose motions have started, or after any problem like fever or anything has started, the child is just lying like this. You're calling the child by his name, like, Bunty, Bunty, and the child is. There is no response, and the child does not want to even move. So much prostration settles in as 4 to 5 loose motions happen, or 6 to 7 vomitings happen, and there is a collapse kind of a condition, and they don't move. There is a sudden kind of indifference to anything. You show the toy with which the child used to be excited, that toy doesn't make any difference. The person with whom child used to feel very happy, the child is not having any difference with that person anymore. So that kind of frustration, dullness, indifference gradually sets in. Now what happened to this mother? She felt so bad. Her knees were completely locked with that sudden emotion. She was not able to move at all. And then after a week's time, she came to seek help for herself, and the husband accompanied her, saying, for the first time I saw her husband, and he told me that, since the time she has ran away, the daughter, she is not sleeping in the night. She is only weeping and weeping all day and night. And this is her state. If you talk to her, if you question her, she is so irritable. She doesn't want to answer to anybody. She just says that, let them go away. She doesn't want to go out of the house. For many months, she did not go out of the house. Only to my visit. For my visit, she used to come over. Rest nowhere. She cut off from everywhere. And she's like, I don't want to talk to anyone, because whenever I go out, they will first ask me, how is your daughter doing? How is your daughter doing? And, there are a set of rubrics: timidity, appearing in public about; quiet, wants to be; repose and tranquility, desires; walking in open air. Open air is a free space where you are getting the required air to breathe in, to have your freedom. But there they just want to be quiet. Okay, reserved while walking in open air. Music aggravates; taciturn in open air; irritability when questioned. Then prostration of mind from suppression of diarrhea. So where there is a continuous flow of emotions, feeling good, and that thing you are so expressive about everything, and that suddenly that expression is suppressed. And then frustration of mind followed by weakness, physical weakness. Frustration of mind with sleeplessness. There is discouraged while walking. The journey, how you are traveling, you are walking, you are going ahead in life. Dullness from cares of his business. So where he was so much concerned, now there is dullness in diabetes. There is this diabetes thing many times highlighted in phosphoric acid in different rubrics. So in diabetes, grief with diabetes, grief from deception, grief prolonged, grief silent with disappointed love. Disappointment causes a lot of problem to phosphoric acid. What is disappointment? Something you had not expected would happen. You expected something else, and this happened. You expected your daughter to be just fine and follow good things in life, and there is a disappointment. So in disappointment, there is an appointment, and then that is not matched with. So dwells on past disagreeable occurrences, on disappointments. Then there are a lot of fears, fear of failure in examination. So all kinds of fears set in, all kinds of fright come in. homesickness with inclination to weep. Now, recently, Gupta sir explained to us homesickness in respect to capsicum. You know, home where you are very much comfortable, you don't want to leave, and you're just going there round and round in that zone. You are not going out of it. So, phosphoric acid's mind is in that thing that, you know, how could my daughter do this to me? How could she do to me? You know, in diabetes, what is happening again? If you see diabetes, there is sugar passing in urine, there is excess of sugar in the body. The body refuses to utilize the sugar which is being made by the body after the food is eaten. So this excess of energy, what is sugar is excess of energy that is just getting drained out. The body refuses. What is this energy? Is happiness. The body doesn't want to accept any more happiness. She's just done with it. I don't want it anymore. No, I don't want to look at her face. I don't want this anymore. This kind of happiness of having this kind of a child in my life. It could be hatred, there could be many other feelings, but there is non-acceptance of joy as a whole if you see in diabetes. So, you know, this is then envy and avidity. Then eating refuses. When eating aggravates, eating after aggravate, again non-acceptance of anything from the environment. So this is what sets phosphoric acid on a path of pathology or any kind of small and big disease. We will continue the last part of phosphoric acid in the following video. So again, I'm repeating, if you want to rise high in your homeopathic career, then do enroll for the MCH course of HHF Academy, and do like, comment and subscribe, and do share this video. Thank you so much. Bye. Take care of yourselves.